Welcome back. We're still on the topic neurobiological theories and psychopharmacology. Before we start, let's look at what we did in our previous lesson. In the previous lesson, we discussed brain imaging techniques like CT and MRI, which helps to visualize the structure of the brain and rule out physical causes. We also looked at PET scans, which shows how active different parts of the brain are by tracking energy use. Finally, we concluded that this technique plays an important role in educating patients and families, helping them see that mental health has a biological basis. And by the end of this lesson, you will be able to 1. Explain the major neurobiological causes of mental health. 2. Describe how genetics, brain chemistry, brain injury, and environment contribute to mental disorders. 3. Identify the role of psychiatric nurses in education, research, and reducing stigma. We will now start this lesson by exploring the neurobiological causes of mental illness health. Mental illness is not a simple problem with a single cause. It's often the result of a complex interplay between several factors with a strong foundation in our neurobiology. These factors include A. Genetics. The family tree can increase one's risk. If a close relative has a mental illness like schizophrenia or bipolar disorder, one may have a higher genetic predisposition to develop it. However, having the gene doesn't guarantee you'll get the illness. Next factor is the brain chemistry. This is where neurotransmitter imbalances come in. For example, a person with depression may have a lower level of serotonin, while someone with schizophrenia may have an excess of dopamine. These chemical imbalances directly affect mood, thought processes, and behavior. Moving to the next factor, which is the brain injury. Physical trauma to the brain, such as a severe concussion or a stroke, can cause significant changes in a person's personality, mood, and cognitive function, sometimes leading to depression or other psychiatric conditions. Now, on to the last factor, environment. Our surroundings and experiences can act as powerful triggers, such as stressful life events, exposure to trauma, or substance use. These can activate a genetic predisposition and lead to the onset of a mental illness. Let's look at a clinical example. A person with a family history of depression may not show any symptoms until they go through a stressful life event, such as losing a job or a loved one. This illustrates the diathesis stress model, a concept that suggests a person's genetic vulnerability, diathesis, and a stressful event, stress, combine to trigger a mental illness. The nurse's role is to help the patient understand this model, explaining that their symptoms are not a sign of personal failure, but a complex biological and environmental reaction that can be treated. All right, moving on to another subtopic. The nurse's role in research and education. As a psychiatric nurse, you are the crucial link between complex science and the person in front of you. Your job is to act as a translator and advocate. Therefore, nurses play a crucial role by explaining brain function and mental illness in simple, non-stigmatizing language, educating families about neurobiological research, that mental illness is not a weakness but a brain-based condition. Therefore, know that simplifying the science is very important. Use simple and non-medical language to explain to patients and families that mental illness is a brain-based medical condition, not a character flaw or a weakness. Another clinical example. A mother asks, "Why is my son hearing voices? Is he possessed?" You can explain, Your son is experiencing what we call hallucinations. And this is a common symptom of his illness and is caused by a chemical imbalance in the brain, much like how a person with diabetes has a problem with insulin. Still on the clinical example, demystifying medication. Explain that psychiatric medications work to restore the brain's chemical balance, much like insulin helps a person with diabetes. Participating in research studies, data collection, and patient support. Advocating for evidence-based practice and treatment. Nurses often bridge the gap between scientific research and patients/families who may not understand medical jargon. Finally, we are done with the session. Let's now summarize what we have done in this lesson. 1. Mental illness arises from a complex interaction of biological and environmental factors rather than a single cause. 2. Genetics may increase vulnerability, but does not guarantee illness. 3. Psychiatric nurses play a vital role in translating complex science into simple language, educating patients and families, reducing stigma, supporting research, and promoting evidence-based care. Thanks for watching. See you in our next video.